As I've often said, the relationship with CARPHA is one of our strongest regional partnerships, and we're very proud of that. We're exceedingly proud of the work that CARPHA has done in helping the Caribbean navigate this severe crisis. So we want to give the assurance that we'll continue to work closely with you, and you can count on every support of the OECS. We really look forward to what we can do together, particularly in this period when things are so dire. Right now we are desperately trying to mobilize resources to help the member states, particularly those most hard hit, to address the situation.
We have had a really good, as you say, CARPHA, we've had a really good working relationship with the OECS, and in particular for this tourism and health program. Maria was just reminding me, they started 4 years ago, so it's been a long process. When we started this, it really was looking at, we're the most tourism dependent, the most travel dependent, and the same thing that brings in so much revenue can also brings in disease. I mean, our first case of SARS and Zika, now COVID. So we had to put in a program that had systems of monitoring and response and capacity building and so on that address health and safety and sanitation aspects for tourism. So that's how we came up with the regional tourism and health program. And like any novel program, you have to advocate. And, the OECS has been a big part of helping us do that. First meeting we had was in 2016 with OECS Ministers of Health. And then when Maria came, new in what she was doing, we would have presented at the Ministers of Tourism meeting in New York, and it started there because they all agreed the need to have a program like this to build tourism in the OECS, as well as to make it. If you build tourism, you build a more sustainable economy. And fast forward to COVID, we would have had to ramp up all that we were doing in terms of surveillance and capacity building, and we would have ramped up our COVID training, and we would have trained thousands of persons from the OECS, and just in terms of St. Lucia, almost 1,000 from just St. Lucia itself. So today really marks accumulation of all of that work, and we've been doing, and we really wanted to concretize that, by this letter of agreement that really pushes us to work in these areas of surveillance and response, capacity building, and marketing us as, a healthier, safer region, the Caribbean region. And we think this partnership with the OECS is going to strengthen that, and we hope that it will provide the tools and the capacity needed to really break that transmission of COVID or reduce it. And so we're really looking forward to this, and on behalf of Dr. St. John, our executive director, she, of course, wish she could be here, but she sends all her greetings, and she's really, really happy for this partnership and to concretize that with the letter of agreement today. Coming to St. Lucia took a lot of planning, and we tried to make it 3 trips into one, literally. So we are launching the program. And we're doing the training in how to use the system, the information, the tourism information system. We're doing advanced food safety training. It's a training that allows for international certification, and that's a 3-day training. And we're meeting with the relevant authorities, health and tourism, and the cruise ship agents and so on, to really find ways to ensure, healthy, safety cruise sailing. And so in there, and we hope, that we would have built capacity, put systems in place that really strengthens St. Lucia capacity. We are now coming from a meeting with Minister of Tourism and PSs of Tourism and Health and so on with the CMO, and really endorse what is happening, and for not just strengthening surveillance, but also for, at this time when we're seeing the numbers unfortunately increasing in St. Lucia, but not just St. Lucia, all over. And so they see this as something that is very timely